Hey everyone, welcome back for another deep dive. Today we're going to be looking at something pretty interesting, the link between a mother's health and her child's risk of developing heart problems later in life.
It's a fascinating area of research and one that has some pretty significant implications for, well, all of us, really.
Yeah, because we're specifically talking about PCOS, polycystic ovary syndrome, which affects a pretty sizable portion of women, right?
Absolutely. About 1 in 10 women of reproductive age will experience PCOS at some point.
Wow, so this is something that touches a lot of lives. But before we jump into the research, let's just quickly remind folks what exactly PCOS is.
Right. So PCOS is a hormonal disorder that can lead to a whole range of symptoms, everything from irregular periods to infertility, weight gain, even an increased risk of developing diabetes or heart disease.
Oh, and mental health too, right? Like
Right.
anxiety and depression.
You got it. PCOS can really impact a woman's life in so many ways. But the one we're focusing on today is that increased risk of cardiovascular disease, or CVD, because there's some pretty groundbreaking research that suggests if your mother had PCOS, you might be at a higher risk too.
Yeah, this is a big one. A massive study out of Denmark and Sweden tracked almost 7 million births over nearly 50 years, and that's what we're going to unpack today.
Okay, so a huge study with a ton of data. That's got to be pretty reliable, right?
Yeah, I mean, you don't get much bigger than that. And the findings are pretty eye-opening. Basically, they found that people whose mothers had PCOS had a 21% higher risk of developing CVD over their lifetime.
21%, that's a significant jump, right? So what exactly does that mean? Like, if my mom had PCOS, am I doomed to have heart problems?
No, 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 not at all. It's all about understanding risk, not predicting the future. What this study does, though, is suggest that maternal PCOS might actually be a cause of increased CVD risk in offspring, not just a coincidence.
Okay, so how did they figure that out? How do you separate correlation from causation in a study like this?
Well, they used a pretty clever technique called cousin analysis, which helps control for those shared genetic or environmental factors that can muddy the waters.
So they compared cousins with different levels of exposure to maternal PCOS.
Exactly. By looking at how those different groups fared in terms of CVD risk, they were able to isolate the effect of maternal PCOS itself.
That's pretty fascinating. So it's not just that families might have genes that predispose them to both PCOS and CVD, or that they have similar lifestyles. This suggests that something about having a mother with PCOS during pregnancy is actually impacting the child's future heart health.
That's the takeaway. It's suggesting that the mother's hormonal environment during pregnancy, all those hormonal imbalances like excess androgens and insulin resistance, can have a lasting impact on fetal development, especially in the cardiovascular system.
That makes sense, but I remember reading something about the study also finding that PCOS alone wasn't the whole story. There was something about a synergy index.
Oh, you're right. Having PCOS plus another health condition like diabetes, high blood pressure, or even a psychiatric disorder really amplifies the risk for the child. It's like a compounding effect.
So it's not just one risk factor, it's the combination of multiple factors that can really create a perfect storm.
Precisely. That's why it's so crucial to consider the whole picture when assessing individual risk.
Yeah.
Not just look at one piece of the puzzle.
Okay, so we've got a good handle on the what. Maternal PCOS can increase a child's risk of developing CVD, especially if other health conditions are also present. But now I'm curious about the why. What are the potential mechanisms at play here? Like, how does this actually happen?
Well, there are a few leading theories, and one of the most compelling is fetal programming.
Yeah, I've heard of that. It's basically the idea that the environment inside the womb can actually shape how the fetus develops.
Exactly. And with PCOS, it seems like those hormonal imbalances we talked about, the excess androgens and insulin resistance, could be impacting how the fetal heart develops, potentially even leading to congenital heart defects or CHDs down the line.
So it's not just about the genes you inherit, but also about the environment you're exposed to in the womb.
Precisely. It's a complex interplay of nature and nurture.
Wow, so much to think about already, and there's more.
Oh, yeah. Another theory is atherosclerosis acceleration.
Atherosclerosis, that's the buildup of plaque in the arteries, right?
Right, and it's a major contributor to heart attacks and strokes.
Hmm.
The study suggests that maternal PCOS might actually speed up this process in offspring, making them more susceptible to these serious events later in life.
So this is way more than just a coincidence. There are real biological processes linking a mother's PCOS to her child's heart health decades later.
It's a powerful reminder of how interconnected our health truly is.
Yeah, seriously. Okay, well, we've covered a lot of ground here, and I think we need to take a breather and process all of this. But before we do, I just want to say to everyone listening, this isn't meant to freak you out. We'll talk more in the next part about what you can do with this information, how to protect your heart health, regardless of your family history. So don't go anywhere.
Absolutely. Knowledge is power, and we're just getting started.
Okay, so I gotta be honest, that first part was a lot to take in. It's kind of intense to think that my mom's health when she was pregnant with me could affect my heart health now.
It is a lot, yeah. But don't panic, all right?
Mm.
This information is about empowering you, not scaring you.
Okay, good, because I definitely felt a little bit of both there.
I get it. But think of it this way. The more you know, the more you can do to protect yourself.
Yeah, that's true. So let's talk about that. What can someone actually do with this information? If I know my mom had PCOS, what steps can I take to, make sure my heart is healthy?
First things first, talk to your doctor, obviously. Let them know about your family history and see if they recommend any early screenings for CVD.
Okay, makes sense. But what kind of screenings are we talking about?
Well, the basics are a good place to start. Things like regular blood pressure checks and cholesterol monitoring.
Okay, yeah, that seems pretty manageable.
It is, and your doctor can tell you if you need anything beyond that based on your individual risk factors.
So it's all about being proactive and having those open conversations with your healthcare provider.
Exactly. And don't underestimate the power of lifestyle changes. A healthy diet, regular exercise, maintaining a healthy weight, those things can make a huge difference in reducing CVD risk.
It's like leveling the playing field a little bit, right? Even if you might have a higher risk because of your family history, you can still take steps to minimize that risk.
That's the idea. It's never too early or too late to start adopting heart-healthy habits. Even small changes add up over time.
So even if I can't give up pizza entirely, switching to whole wheat crust is a step in the right direction.
You got it. Every little bit helps.
Okay, good to know. And I'm guessing smoking is a big no-no.
Yeah, smoking is a major risk factor for CVD, regardless of family history. If you smoke, quitting is one of the best things you can do for your heart.
All right, point taken. Now, even with this massive study we've been talking about, it feels like there's still a lot we don't know. What are some of the areas where further research is needed?
Oh, there are tons. For one, we need to really dig into those mechanisms of fetal programming, figure out what's actually happening at the molecular level during those critical stages of fetal development.
Yeah, that seems pretty complicated.
It is, but it's crucial to understand how those hormonal imbalances are actually impacting the formation of the heart and blood vessels.
Makes sense. What else?
Well, we talked about the role of offspring obesity, right? That's another big question mark. How much of the increased CVD risk is directly related to weight and how much is independent of it? Answering that question could help us develop more targeted interventions.
Oh, that's interesting. And what about the differences between men and women? We know that heart disease can affect them differently. Could there be unique risk profiles for male and female offspring of mothers with PCOS?
Absolutely. That's a really important area for future research. We need to understand those sex-specific impacts to provide the best possible guidance and care.
Wow, so many fascinating avenues to explore. It feels like we're just starting to scratch the surface of this whole connection between maternal health and offspring CVD risk.
We are. But the knowledge we have now is already incredibly valuable. It's really shifting our understanding of health, showing us that it's not just about our individual choices, but also about this legacy we inherit and the one we pass on.
I love that. The legacy of health. That's such a powerful way to think about it.
It is. And it's a legacy that we can actively shape through knowledge, awareness, and of course, proactive healthcare choices.
Okay, before we move on to part 3, where we'll be looking at the specific types of cardiovascular disease linked to maternal PCOS, I want to touch on something that came up earlier. You mentioned that the study might have captured more severe cases of PCOS, which could skew the findings, right?
Right. This study used medical records, which means it likely missed women with milder PCOS who didn't seek treatment or whose records weren't captured.
So the true prevalence of PCOS, and maybe even the strength of the link to offspring CVD risk, could be even higher than the study suggests.
It's definitely possible. It just highlights how important research and awareness are.
Right.
We need to reach all women with PCOS, regardless of how severe their symptoms are, and make sure they have the information and support they need.
Absolutely. Okay, so we've covered a lot of ground here, but what's the one big takeaway you want everyone to walk away with from this part?
I think the most important thing is that knowledge is power when it comes to your health. If your mom had PCOS, this research shows how important it is to be proactive. Talk to your doctor. Get those screenings. Make those healthy lifestyle choices. You really can take control of your health.
Well said. All right, everyone, stay tuned for part 3, where we'll dive deeper into the specific types of cardiovascular disease linked to maternal PCOS. It's going to be fascinating. We'll see you there. Okay, so we've established that a mother having PCOS can really increase her children's risk of developing heart problems later in life. But let's get into the specifics. What kinds of cardiovascular issues are we actually talking about here?
Well, the interesting thing about this study is that they didn't just lump all heart problems together. They actually looked at the risk for different types of CVD in people whose mothers had PCOS.
Oh, okay. So break it down for us. What were some of the connections they found?
One that really stood out was the increased risk of ischemic heart disease.
Ischemic heart disease. Remind me what that is again.
Sure. Basically, it's when plaque builds up in the arteries, and that restricts blood flow to the heart muscle itself.
Oh, right. And that can lead to heart attacks.
Exactly. It's one of the leading causes of heart attacks. And this study found a significantly higher risk of it in people whose mothers had PCOS.
Wow, that's pretty scary. What about stroke? Did they find a connection there too?
They did see a slightly elevated risk of stroke, but it wasn't as strong of a connection as with ischemic heart disease.
Interesting. Anything else?
Yeah, they also found a pretty clear connection with hypertension.
Hypertension, that's just high blood pressure, right?
Yep, exactly. So we're seeing a pattern here, right? Maternal PCOS seems to be linked to a higher risk of several different cardiovascular problems.
It really does. But why? What's the common thread?
Well, if we think back to those potential mechanisms we discussed earlier, fetal programming seems to play a key role.
Right, because those hormonal imbalances that are so common with PCOS, the excess androgens and insulin resistance, those can actually affect the development of the fetus.
Exactly. And even though a child might not develop PCOS themselves, that exposure to those hormones in the womb can have consequences years, even decades down the road.
So it's like those early experiences, even before we're born, can have a ripple effect throughout our lives.
It really is amazing, isn't it? And the heart is such a complex organ, so any disruptions during those early stages of development can have lasting effects.
That makes sense. Okay, so knowing all of this, what can people actually do about it? I mean, if you know your mom had PCOS, are there steps you can take to reduce your risk?
Absolutely. A lot of it comes back to those healthy lifestyle choices we talked about earlier. Maintaining a healthy weight, eating a balanced diet, getting regular exercise. Those are all so important for preventing CVD, regardless of family history.
So those things are like extra important if you know you have this increased risk.
Exactly. And, don't wait until you have symptoms to start taking care of yourself. Be proactive. Talk to your doctor about early screenings. Get regular checkups. It's all about taking control of your health.
So it's not about living in fear, it's about being informed and empowered.
That's a great way to put it. And I think that's really what this whole deep dive has been about,
Right.
understanding this connection between our health and the health of our mothers, recognizing that we're all part of this larger story that goes back generations.
It's kind of like we're building on the legacy of those who came before us.
Exactly. And that's both humbling and empowering, right? We can't change our family history, but we can make choices that shape our own health and the health of future generations.
I love that. It's a great reminder that our health isn't just about us, it's about something much bigger.
It really is. And beyond the knowledge and the empowerment, I hope this deep dive also sparks a sense of curiosity in our listeners
Curiosity about what?
about their own health journeys. What factors have shaped their health, both genetic and environmental? And what can they do to optimize their well-being, not just for themselves, but for future generations?
It's about going beyond just absorbing information and actually using it to ask questions and explore and really learn about their own unique stories.
Exactly. Because our health isn't static, it's this dynamic, evolving narrative, and we all have the power to be active participants in writing that story.
That's such a beautiful way to put it. So on that note, I think we should leave our listeners with this question. What questions does this research spark in you? What aspects of your own health journey are you curious to explore further?
And remember, you're not alone on this journey. There are so many resources available, so many communities you can connect with. Keep learning, keep asking questions, and most importantly, keep taking care of yourselves.
Well said. That's all for today's deep dive. We'll be back soon with another fascinating exploration of the science that shapes our lives. Until then, stay curious and stay healthy.